A therapist always needs to assess for addiction. You can't tell by looking at somebody. Just because a guy comes in a business suit and a briefcase and looks like he's a real high-powered kind of executive doesn't mean he doesn't have an addiction. So addiction has multiple faces. It affects all socioeconomic backgrounds, and the only way to know is to ask about it. But it's very important to gain experience working with addiction and asking about it, because it can be one of the main obstacles to the therapy itself. I mean, if you're stoned or especially coming into sessions high, it's going to be difficult to work through your struggles. A lot of therapists are afraid to ask questions about addiction because they think they're going to offend their client, or somehow the client thinks that they're being nosy or something like that. But something to keep in mind, and something I explained to my supervisees, is your client is expecting you to ask questions, and personal questions. That's why they're coming to you. It's in the delivery of the questions and what you ask and how you ask that's important. And there are ways of doing that that are not offensive and allows the client to open up in a way that after they've shared with you their struggles with addiction, they feel a lot of relief. Sometimes when we have a client who has an addiction, we can work with them for a long time and them never make any attempts to stop. They might say, yeah, I think I have a problem with it, but I don't want to quit. And you have to be prepared for that, because someone confronting addiction and getting help is something that it's a journey that they have to kind of walk on their own, and you guide them as their therapist. Now that said, there are therapeutic interventions you can do to move clients towards getting help. For one, you ask about the addiction, you assess it in a way that enables you to collect enough information about their addiction, and then you may say, okay, can we keep this as a topic for conversation from time to time? We might talk about it next week, we might not. We might talk about it in 4 months. But can we sort of kind of keep it on a mental blackboard as something to revisit? Because you're not sure if you are struggling with an addiction, and I'm not really sure quite yet. But as time goes by, we'll find out, and then you can make decisions about whether you want to change in that area. See, so addiction is something that you can't force, and a lot of new therapists do get very frustrated when a client isn't changing quickly enough. In terms of how to assess for addiction and how not to, I'll give you 2 very brief lines of questioning. You ask, when is the last time you had something to drink, or if you do, smoked a joint or whatever. And they answer, well, it was last night. You ask them, well, what did you drink? They might tell you rum. And you ask them, well, how many drinks did you have? And they'll say 3. And you ask, well, before last night, when was your last drink? And they'll tell you, yeah, well, I drank the night before as well, about the same amount. And maybe you might ask one other follow-up question, such as, have you ever thought that your drinking is a concern? And oftentimes, they will say yes. So now you've already got a pretty clear picture of addiction with this person. They think it could be a problem, which in itself is diagnostic. If they're saying it's a problem, who's to tell them it's not, right? Mm-hmm. Now, the way to not assess addiction is to say, are you an alcoholic? Say, who's going to say yes to that? Nobody.